So, can you already hear me? Okay, wonderful. Very briefly, good afternoon, almost good evening. My name is Oliver Schmidt. I'm working for CSL Behring, but today I'm here on behalf of the European Board of Advisory Committee of PPTA, and who is attending this conference not only since today, but already the last years. So you might have already seen me. So there might be a link between my presence here and the award we are going to present. The award I am talking about is the award of which takes the name of Joachim Hilfenhaus. Joachim Hilfenhaus was a well-known virologist. He was the chairman of the AIPPI, and heavily involved in the safety and continuous, let's say, efficacy or improvement of efficacious treatment of plasma derivatives. So, unfortunately, Joachim Hilfenhaus passed away relatively early, much too much early, and therefore PPTA decided already in 1998 to create an award, and this award then should be given to physicians, specialists doing the utmost for improving the therapy of patients suffering from rare diseases treated with plasma derivatives, different types of plasma derivatives. You might remember some of these famous physicians, professors, which cover the whole area of rare diseases. So the first one in 1998 was Ingmar Nielsen from Sweden. After that, we had a long list of very important names such as Professor Brackmann. So then we went to another area. We had Professor Manucci in the area of hemophilia. So Professor Arroyo and Professor also Bernardi covering albumin therapies, hepatologists. So you ask now, who will be the person this year? And someone knows already, just gentlemen. So normally we did it differently. So I was here and was trying to create a business suspense. So now already, because we see, Jan, you're still here, but you're lacking regarding the last dot of the organization. So normally then I told about the name, briefly introduced the person, and this was today slightly different. So today's winner is Professor Volker Wahn, who's already to me on stage. Professor Wahn, I think. So here, I have to be honest, this is a relatively long list of numbers, despite the fact that I'm a commercial, so I remember numbers pretty well. So here, just a few numbers which try to resume what Professor Volker Wahn did. So, first of all, I have to thank Professor Wahn that he is today around, because he was sick till a few days before, and thanks to the fact that today we are in Berlin, and Berlin is not only the place of residency of Professor Wahn, but also the area where he terminated a long, very long years, a list of important assignments, so working at the Charité hospital in the area of immunology. But before that, a very brief summary of what Professor Wahn did. So he became a physician after studies in Heidelberg, if I remember correctly, in the year 76. So then became a specialist in allergology as well as in pediatrician, as a basic and allergology and pulmonology. Moved over the ocean, over the Atlantic, spent 2 years also in a research area of cancer at New York, at the Slam University Children. Oh, this was a difficult one. You will help me on that. What was the exact
Memorial Sloan Kettering Cancer Center.
Thank you very much. So I'm very happy that you're here also for that. So after that, he moved to Düsseldorf, where at University Clinic did a very long and important contribution to both treatment as well as to research till 1999. In between, he became professor and moved from Düsseldorf to a clinic in Uckermark, which was a step in between Charité, where you spent the last 7-8 years of your university career, treating primary immune deficiency. So if I understood correctly, you're also at that point part of the Jeffrey Modell Foundation as a center, which you already had it since the beginning of the years 2000. So a very long list of important activities, which Professor Wahn will briefly introduce to you. He, with PPTA, has a very long-standing collaboration, which I think has to mention here because this is an outstanding example how industry can work together with academy in order to better, let's say, research and specifically diagnosis of treatments. What I'm talking about is Find ID, and I'm pretty sure, Professor Wahn, you will tell us about others also about Find ID. If there is any other point you would like to ask afterwards, Professor Wahn will be with us also after this talk, when we will meet after his, let's say, presentation outside to have, let's say, a brief aperitif for dinner. So having stated that, I should also have Melanie. Thank you very much. So normally we have thank you very much, Melanie. Normally we have an award with a very nice sculpture. The award is also both a value as well as a symbol sculpture. This sculpture, in these days where supply is an issue, has not arrived in time. We ordered it in time, but it's still there. I don't know why. So therefore, this is what we are currently using as a kind of compromise. Professor Wahn, I do know that we do it like that here. So, thank you very much, and very happy that you are today's 2022 Hilfenhaus Award winner. So, please take this with us.
Thank you very much.
The floor is yours.
Okay. Well, thank you, Oliver. And I would also like to thank the jury for considering me for this prestigious award, although I don't really know why I received it. I just did my work, and so nothing special. But the jury might know. So I'm a person interested in primary immunodeficiencies, and I would like to share a very few thoughts with you before we all will enjoy the reception. This is a severe damage and it has nothing to do with patients, of course. But once you see this car crash, you think about it, wouldn't prevention have been better than waiting for this crash? So this is a human situation. It's another crash. It's a baby with severe combined immunodeficiency developing a pneumocystis pneumonia, which requires mechanical ventilation within a very few hours. And for these children, of course, we do have a solution. We have a newborn screening program since 2019 in Germany that works as effectively as in other countries too, and has saved many lives. What we do is we take blood from the heels and analyze them for the tracks, the T-cell receptor excision circles, which correlates with the number of mature T-cells in the blood. So that was the good news. The bad news is that there are many other patients with primary immunodeficiency that we do not detect with this method. Only a very small amount is detectable by screening. So we need to do something about the others. The others have problems too. This is a 3-year-old boy with a combined immunodeficiency, developing a bilateral pneumonia, and also already shows bronchiectasis. This is a 10-year-old girl with an IgG subclass deficiency, with a destroyed lung. This is an adult with common variable immunodeficiency, with bronchiectasis filled with pus. And we need to do something about the others. Wouldn't have a PID diagnosis and early treatment have been better than waiting for these conditions? We know that IgG treatment helps in these patients, but it requires a diagnosis. We're not very good in this respect. I selected 3 papers dealing with the question of diagnostic delay. And the authors showed that within a range of 4 to 15 years, the diagnosis is delayed. So we need to do something better. This is a boy with chronic granulomatous disease, not IgG deficient. And you see that is in a really bad shape. And again, the question comes up, wouldn't a PID diagnosis and early treatment have been better than waiting for that condition? We saw this patient in Berlin, and after a long course of treatment, including stem cell transplantation, he is a healthy young man. So, in order to develop things in Germany, we created the Find ID network, which Oliver already mentioned. This network tries to bring together all doctors of various medical subspecialties interested in the field of PID. And for those, we have developed several brochures specifically for these medical subspecialties. 2 further brochures are supposed to be released in this year. In addition, for the experts in PID, we have the website Immundefekt.de, which provides informations on how our immune system works, gives you information of normal values, age-dependent on immunoglobulins, IgG subclasses, CD markers of various cells. And in addition, we have a news ticker, which news every day. And once you think this is an interesting paper, you can directly approach the abstract in PubMed. So early detection of PID is useful and possible. Just let's do it. Thank you.